You're caring for your loved one, but who's caring for you? Let's talk about it in today's episode. What I've found to be the case in most families is that at some point in time there's somebody in your home to be cared for. It could be the grandmom, it could be great uncle, it could be maybe a child with special needs. But at some point, each one of us will either be giving care or will need care. And it's a daunting task, and it also comes with a lot of stress, and it also comes with a lot of heartache. There are families in many communities who they try to handle it all on their own, which makes this challenge even greater for them because they're not aware oftentimes that there are services that are available. And then secondly, they are not aware of the things that need to be done because they're not professional caregivers, so they don't have access or the knowledge that they would get from a professional trained caregiver. So some of the people I've seen, which is basically really struck a nerve with me, was a 14-year-old girl whose mother was a diabetic and she was dying from the disease and she was wheelchair bound, and it was just a 14-year-old daughter, and she dropped out of high school and she's coming home and not going to school. She's just taking care of her mother all day and she doesn't really know what to do. She's not a healthcare professional, so she's managing as well as she can. But they had another problem because the mother was divorced. They were living in squalor. The home was absolutely filthy, and they had a guard dog, which was a large German Shepherd, and the dog was having run of the house. He was defecating all throughout the house. This is a situation where this family is in one crisis and they're also creating another crisis, and they're not aware. I've seen that in more than one case where there's a family member who's doing the best that they can with the resources that they are aware of or the resources that they have, and they're really being challenged and in some cases traumatized. They're overwhelmed with trying to do the best that they can to care. And the last thing that actually gets done is the cleaning. The home actually doesn't get done. So when the person feels overwhelmed, things just fall off the radar. Sometimes there's dementia that comes into our families, and sometimes there are other diseases that will impair a person's judgment, impair their sensibilities. This becomes a level of stress for a person who's a family member who's doing the best that they know how, but they don't have any training in those medical diseases. There's many aspects to dementia. It takes a person who's skilled and trained in those areas to even identify when it is that your loved one doesn't no longer recognize who you are and thinks that you're an intruder in their home and that you're handling them, you're touching them. So what doesn't happen in these environments is that the house doesn't get cleaned. These are types of things that will wear a family member who's providing care for a loved one. It will wear you out totally and completely to the point where now you're not thinking properly, you're making bad decisions because the stress is wearing out your ability to think clear. And the environmental hazards that accumulate are going to exacerbate the trauma that you're having, and more likely you're going to find yourself in the hospital needing care while you're trying to provide care. I tell people, well, if you get your house intensively cleaned, it doesn't have to be intensively cleaned every day. So these are some of the challenges that caregivers who are non-professionals are facing, but at the same time, when a caregiver who is a professional goes into a home, say for example you're a social worker, you don't have a track record of any of the activity that preceded your coming to that home. So if there's hoarding activities going on and they had exterminations come in the past, you don't have any record of that. So when you're walking into that environment, you have a lot to consider. So caregivers have to be mindful that they are vulnerable to be a stroke candidate if they're caring for a loved one and the house is not being cleaned, because you're accumulating toxins, you're accumulating dust particles, and if they don't get addressed, they're going to show up somewhere in your health because they're showing up in your body. They're going to be in your lungs, it's going to be in your blood, it's going to be in your nose. And so these are some of the issues that caregivers have when they're trying to care for a loved one. So if you're in this kind of situation and you're not the only one, here's the thing to think about. There's a service that's available, we provide it. Reach out to us and let us know that you need the service, you need an inspection. We'll show up pronto to take care of you, to keep you safe and keep your family safe. This is not maid service, this is intensive cleaning. So reach out to us with the information below and we'd be glad to help you.